through telemedicine. We would like to invite Dr. B. Krantikiran Garu to talk on today's topic. Over to Dr. Krantikiran Garu.
Good morning, everyone. How is
morning.
everyone this morning? Hello? Can you all hear me?
Yes, sir,
we
please.
can, sir.
Yes, sir.
Please
We can.
continue.
Okay. So let's get started. So as we all know, COVID-19 pandemic created a global crisis for mental health. Thousands of families were devastated by loss of loved ones, and depression and anxiety skyrocketed during the first year of COVID-19. So today's topic is depression. So as we all know, sadness touches all of our lives at different times, but depression can be devastating. To understand depression, please think of the worst day you ever felt in your life and imagine feeling like that every day, day after day, and not knowing why. Think about what it is like not being able to sleep, not being able to eat, and not being able to enjoy life. Depression is a terrible disease and is something that cannot be wished away. Feeling hopeless, helpless, worthless, or just empty and numb are the classic signs of depression. You may find it difficult to concentrate, to make decisions, and you may not be able to enjoy things that gave pleasure in the past. You may also notice you're sleeping too much or too little, eating too much or too little. You may also have fatigue and feel drained out. You may have headaches or aches and pains that do not seem to have an obvious cause. Approximately 1 in 6 adults worldwide suffer from depression at some point of their life. Too many people suffer in silence, unfortunately, and do not seek help. But the good news is that depression is very treatable, like any other medical illness. Medications are the mainstay of treatment, and therapy and counseling can help. One study showed that for those people who took treatment for depression, depression lifted completely in 7 out of 10 people. And for the others, there was significant improvement in symptoms. Effective treatment can lighten up mood. It can strengthen relationships and allow people to enjoy hobbies and life again. But to find the right treatment, you may have to have patience and perseverance. Some people immediately find a medicine or therapy that can work for them. For others, it takes a few trials of medication and therapy. There was a famous study called Global Burden of Disease, published by Harvard School of Public Health, WHO, and World Bank. According to it, depression will be the first major cause of disability by 2030. The problem is depression is a terrible disease as it is associated with suicide. It is estimated there are about 800,000 suicides worldwide each year. And of these, about 135,000 are in India. On a sad note, there is one student committing suicide every hour in India. And for every person that died of suicide, there are about 20 others who attempted suicide. It is thought that 90% of suicides are related to mental illness, which is undiagnosed, untreated, or undertreated. So right now, I'm ready to take some questions, if I may. Can you all hear me?
Yes, sir. Yes, sir.
Yeah, I'm so sorry. I have a sore throat. I have some kind of viral infection. So I have a squeaky voice, but I can take some questions.
Sure, sir.
Dr. Kranti,
Yeah, please.
Dr. Ashish Chauhan here. I'm really happy to hear that part of your depression thing. So as you have had a practice in United States, how do you see the depression as a disease? How different do you find the patients in the United States and in India? And what do you believe doctors or the common population should focus at? With the people of 1.5 lakh, or 1.5 lakh Indians dying with the stress-related suicides, it's a tsunami, and we need to address it well. What are your suggestions for a common people?
Absolutely. You see, the fact is, depression does not discriminate. It hits every society, every culture, and every profession. So when it comes to symptoms, there's not much of a difference between India and the United States. The symptoms are the same, but the thing is, depression or mental illness for that matter is considered a taboo, unfortunately, in India. Things are changing though. Things are changing for better. People are more open about discussing how they feel. And more often, is the family members who are jumping in to help patients suffering from depression or any mental illness. So there's a lot of terrific family support in India, which is a plus, unlike in the Western society.
Sir, you have quoted that India, for every 1 hour, Indian students are dying with suicides. So what is the thing that we can do to tackle this situation?
You see, the problem seems to be parental pressure. I think that seems to be the big problem when it comes to academics. Parents pushing their kids too far. Everyone wants their kid to be a doctor, engineer, or attorney, whoever. But there seems to be a big push, a kind of slave drive into securing admissions into professional courses. That needs to stop. That kind of pressure from parents needs to stop.
We have a blessed presence of one of the very leading diabetologists, Dr. Muazzam sir. Before I ask him, I would be very happy to invite Dr. Ehsan, the medical director from superintendent from Telangana Institute of Medical Sciences. He has been handling the COVID and its menace like anything. So, Dr. Ehsan and Dr. Muazzam, any comments from your side? Especially with the COVID killing so many people, and obviously.
Yeah, excellent input, sir. My contention regarding this is that whoever the patients that are coming, basically, it's very difficult to identify them unless and until somebody else speaks for them. So I think it should become mandatory that whenever the patient is coming with one of the relatives need to be spoken first rather than the patient, because that's the best input you can get to come to a conclusion, because the patient may not be in his perspective of his mind to speak up.
That's an excellent statement. That's an excellent statement. As a matter of fact, it's the collateral information from families that helps us diagnose any form of mental illness. More often, it's the families who provide information rather than the patient. Any other comments? Any other questions, please?
Sir, good morning. Myself, Dr. Santosh Murthy. I have this genuine question which I have seen among my friends. So we doctors, we treating doctors also go into depression and get unnoticed. So how do you suggest what kind of tips should be given to the doctors and how to identify that they are going into depression and how can you help them?
That's a very good question, doctor. You see, as I already mentioned, depression does not discriminate. I cannot tell you how many physicians and medical students I see in my practice every day. You see, medicine as such is a very stressful job. So, as a part of our life, if we are noticing we had difficulties sleeping, both trouble falling asleep or staying asleep, and if we have lack of concentration, if we are getting forgetful, if there's a loss of appetite, or anhedonia, which is a loss of pleasure in life, these are the red flags for depression. So we need to watch out for these kind of symptoms first. Most commonly, disturbance in sleep, appetite, energy levels, concentration, and memory.
Okay, sir. So you suggest that doctors should go and meet their psychiatric friends and discuss about these things?
Absolutely. Whenever there is any of these red flags as mentioned by me, please seek professional help. Please see a psychiatrist right away, because the fact is, the earlier we treat, the better.
I'm very much delighted that we have our moderator, Dr. Subbimal Bhattacharya, sir, the senior most consultant physician from Apollo Hospitals among us. And yes, depression is troubling everybody possible, irrespective of profession. Dr. Bhattacharya, sir, any comment from your side for Dr. Kranti? We are very delighted to have even Dr. Rajesh, the Vice President from Indian Radiological Society. Any comments from sir and others also? I think this platform is very important, at least for today, because yes, the doctors themselves are getting into the trap of suicide, and the gynecologist from Rajasthan committing suicide because of harassment. All these things need to be addressed upon. I would be very happy if you all are vocal about it. Over to Dr. Bhattacharya, sir. I'm yet to hear the voice of our medical superintendent, Dr. Ehsan.
And
Good morning, sir. And thank you very much for inviting me to this very great program today, because on the occasion of World Health Day, sir. Thank you, Ashish, sir. And thank you, the dignitaries and the chairpersons over there. Having been in COVID for such a long time, almost more than 2 years now, and treating more than 15,000-20,000 patients, and many of them affected with this depression or anxiety disorders, I can divide as per my experience after being in COVID for 2 years. They can be treated as anxiety disorders in the early COVID times, and long haulers, they lead into depression life. Few patients I have seen which are on follow-up, as sir was rightly speaking about that, more particularly in doctors. And some doctor has pointed out here how to treat the doctors. And as sir was rightly saying, please come up with your problems. That is the only solution which helps us in guiding or treating whatever the problem is. That is what we have seen. And most importantly, as sir was rightly speaking up, that speaking with family members, that is most important. During COVID period, because of this social distancing and all, we miss this aspect, sir. That is what I experienced while working in COVID, because no attender was willing to come inside the building also, inside the room also. Many doctors, even in Hyderabad, we have seen many doctors were not given the opportunity to enter into the premises, the rented premises or anything in the apartments or something like that. So that was the phobia. But later on, it slowly waned off. That's what I have experienced during this COVID, sir.
Okay, I am Dr. Bhattacharya. I had some question to you, sir.
Yes.
Actually, all these depressions, whether to be treated by just psychotherapy or to be treated with the medicine?
That's a good question. You see, the mainstay of treatment is medication. Maybe I'm biased because I have more of a neuropsychiatry background and I am more of a biological psychiatrist. But the fact is, medication is the mainstay of treatment, and psychotherapy, particularly cognitive behavioral therapy, can be an icing on the cake. It really supports medication management. So the best treatment is always a combination of medication and psychotherapy, preferably CBT, cognitive behavioral therapy.
Thank you. This is very nice because we are told sometimes that if this one medicine treatment is given initially, then the chances of relapse of the depression are there in future.
Yeah, you see, that's a very good point. Depression is a chronic illness, just like diabetes or hypertension. Having said that, it does not mean once the medication is started, it has to be taken for life. It does not mean that. We have some guidelines according to APA, American Psychiatric Association, which says the first time we figure out a medicine that works for a particular patient, the patient has to take it for 12 months minimum. Even if they feel totally normal in 3 or 4 months down the road, they should not stop it. Okay. If they stop the medicine prematurely before 12 months, the risk of relapse multiplies 3-fold or 4-fold. So the first session of medication management is for 1 year. After that, we slowly cut off the medicine and see how the patient does. If there are no issues, no need to go back on medicine. If the issues start to creep in again, another 1 year starts from that point in terms of medication treatment.
Thank you.
Thank you, Dr. Kranti. Happy World Mental Health Day.
Thank you. Thank you, Doc.
I am Dr. Minhaj. I am also Vice President and President-elect of Indian Psychiatric Society, Telangana State Branch.
Nice to meet you.
Nice to meet you, sir. Thanks for taking up this issue with medical practitioners. It is very important because most of our cases of anxiety and depression, the first point of contact is medical doctors, and then they are referred sometimes to psychiatrists. Many a times they are practitioners. So I would like to congratulate you and thank you for a wonderful presentation and wonderful interaction, sir. Thank you.
Thank you, Doctor.
Thank you.
And Dr. Ashish, are you there?
Yes, please.
Yeah. So just for our colleagues here today, if anyone needs help in terms of anxiety or depression, I am glad to help out. I'm here.
Thank you, sir. That was a very great insight and input. And I would want to invite everybody to Dr. Kranti's center in Mavan, which is in road number 2, opposite to Rainbow, and one of the very, very great and blessed place to at least sit and enjoy the ambience of his room. Anyhow, and definitely all poor husbands need it. I am very much sure Garima and Nalini and others didn't hear that. So on the direct note of it, Nalini has put the question that other than does the cycle, can you read out the question, please, Dr. Nalini or Garima?
Sir, Dr. Nalini has said that is only counseling going to help, or some non-addictive drugs can also help?
Okay. Is this question for me?
Yes, sir.
Yeah. So as already discussed, medication is the mainstay of treatment for depression or anxiety. And counseling always helps on top of that. Most people need both. But without medication, there is no research supporting that there will be improvement just with psychotherapy.
Good morning, sir. My name is Sarita. I'm a family physician in Hyderabad.
Yes, doctor.
I would like to ask about once, yes, anxiety and depression, when we diagnose, either we treat them or refer to psychiatrist or psychologist. However, I find in community as a family physician, one thing which is difficult, that is when the person doesn't have insight, or when the family doesn't have insight into what is going on. Could you discuss about the laws or the emergency laws that we should be able to know in India for detention or for admission, or whom do we call in case of emergency?
See, I sincerely apologize because I don't really know the legal system in India yet. Yeah, because I know the American system, but India, I'm still learning. I'm afraid I'm the wrong person to ask that question.
Good morning, Kranti. This is Dr. Srinivas. Is there any difference in the treatment of regarding to the children and adults? Just I had an understanding that the supportive therapy is mainstay in when treating the children, rather than the pharmacological treatment. Which do you prefer in the children? Is it a supportive treatment or the pharmacological treatment? Suppose what are the drugs which are being given in the children, and what is your experience regarding it?
It all depends on what's the diagnosis. You see, for any psychiatric treatment, a good start is a psychiatric diagnostic evaluation, because children can have a multitude of diagnoses. They can have depression, they can have ADHD, they can have autism, they can have anxiety, they can have substance use disorder. So it all depends on the diagnosis. And as a part of treatment, medications are extensively used in children if need be.
Okay. Okay.
Regarding the question put forward by the legal aspect of suicidal behavior in India, or patient harming himself, there is a law called Mental Health Care Act 2017. It was implemented in 2017, and according to that, we can admit or we can treat a patient at least for 3 days without a psychiatrist can admit and treat the patient. And after 3 days, we can inform the mental health authority and keep the patient indoor if the patient is suicidal or homicidal according to the Mental Health Care Act 2017. I hope this answers the question of our colleague.
So, doctor, sorry to intervene. I have a question.
Yes, sir.
Do the police intervene in India if we have an acutely suicidal patient?
Yes, sir. We had this law, Mental Health Act of 1995, wherein the police, somebody could go to police and complain, and police can take the patient to a magistrate and get him treated and admitted.
Okay, yeah, that's a kind of like in the US, where the police are the first people called for, and
Yes,
they
sir.
come and take the patient to the nearest psychiatric ER.
Yes, but nowadays, after this MHCA 2017, it has not fully come into force in our country or our state. But here you can approach a psychiatrist or mental health care authority, that is Superintendent Institute of Mental Health, Eragadda, and he can give the directions, and he can give directions, and he has power of a magistrate.
Okay,
Now,
that's Dr. Umashankar, is it?
Yes, Dr. Umashankar.
Yeah, okay, all right. Thanks, Doc. Thank you.
Thanks for that input. Yes, and the worst problem is, what if police is the reason behind the possibilities of suicide and suicidal ideation?
Many a times it is. Yeah.
Quite often it is. We know it very well. It's a politician, bureaucrats, and police, which definitely makes life better as well as worse. Depends on which side of them you are at. So thanks a lot. That was a wonderful insight into the depression. I love the title. It's a terrible disease and a treatable one. So I'm very much sure everybody is enjoying this session and they will do their part. Being a past president of Lions Club of Hyderabad Allied Doctors, I invite each one of you, especially the doctors, to be joining their hands in this, because over the years, and me being a physician for more than 20 years, we have realized one of the super best way of treating your own stress and your own depression is getting involved into the selfless social service. Whenever you are giving a 5 rupee worth of, Parle G biscuit to an orphan, and when you take your time out, you realize whatever millions you have you can earn during your practice or in different means are not worth it, rather than the smile of that orphan child. So I definitely invite every doctor. Our branch is exclusively for doctors only, and we as a member of Allied Doctors Club invite all of you to do that. Our president, Dr. Srinivas, said right now he is in transit from London to Hyderabad, so probably he is not able to join. Any questions from anybody else? Thanks, Minhas, for asking this blessed question. I'm so very happy Dr. Ahsan from Telangana Institute have joined, and Dr. Santosh from Nalgonda all the way, who's doing a blessed job of saving the limbs. And a day before was the Podiatrist Day. So yes, we all have to continue doing our work. I would be very happy to invite Dr. Sudhir Charles. He is one of the leading pediatrician, a college mate from CMC Vellore. And I would be very happy if he speaks out few words, especially the depression among children, or especially the teenagers. I think with the laptop, with cell phone, the teenagers have become a big tough subject for all of us to handle. Dr. Sudhir, would you want to comment? And along with him, I would be very happy if other seniors like Dr. Bhattacharya and pediatricians take a note of this and speak out few things about teenagers and their depression. Over to Dr. Sudhir and Dr. Bhattacharya, sir.
Yeah, I think this is a very important topic to address, because unfortunately, because of social norms and various other factors, mental health has not been given an adequate space in our not only in our talk process, but even our thinking process. For the most part, when the patient walks in, we talk about their physical health and not so much their mental health and how their relationships are. Not only with themselves, but not only within the family, but with themselves. And like Dr. Ashish pointed out, it's important to take time out and maybe even money out, and to be able to contribute to the society And we do not understand the direct implications of how the help that we give to people actually blesses us more than them. Like it says in the blessed book, it's more blessed to give than to receive. So we've seen it in our own lives, and as to how when we have done it, it's been a blessing to us. But at the same time, we are so grateful to all the psychiatrists and the psychotherapists who are doing enormous amount of work for given the burden of the disease in India. And we are grateful for their work. Thank you, Dr. Ashish.
Thank you, Dr. Charles and Dr. Kranti, for your excellent remarks and all. Regarding Dr. Charles, we know that Dr. Kranti, we all know that now artificial intelligence, machine learning is invading in all the spheres of the medical science. So whether this artificial intelligence or machine learning is also invading the depression, treating the patients with depression?
Not yet. Not yet. I know there's tons of research going on at National Institutes of Mental Health in Maryland, but still, I think it's at least a decade away for the technology to come into depression.
I would like to add, sir. During COVID times, artificial intelligence and robotics were used thoroughly in cases of autistic children. So I would like to add that regarding depression in children, usually children don't present as sadness of mood or somatic complaints, but they come with irritability. So many a times children would keep to themselves, they won't mix up with people, they will throw tantrums, they will get irritable. And these are the signs of depression in children. So we need to look out for these children. Nowadays, with advent of mobiles and gadgets with children, most of the children, they keep themselves isolated. So as such, we don't know whether it is because of depression or because of overuse of these gadgets. But definitely not taking food or getting irritable at little things are some signs which we can look for in children. So irritability rather than sadness of mood is cardinal sign in children and adolescents. Thank you for depression.
Yes, that's a good point. That's a good point. Yeah.
Sir, I would like to add up.
Yes, sir.
See, basically, whatever the amount of input they're getting from those gadgets, the information on the internet is so vast. And in fact, the children are getting confused between information and knowledge. There's a huge difference between this. And they're easily influenced by the information rather than trying to get to the right knowledge from the right person. So this is another thing that is adding up to their confusion. And they are only determining the facts that have been shown on the Google. See, it is one fact. Google is one followed by 1,000 zeros. So it is one fact correct. The rest are all the search engines which you need to switch on. And the children have developed this habit. What next? What next? What next? So I think somewhere proper counseling would definitely help the children to make them understand that information is different and knowledge is different.
Yes, Dr. Morzam, that was a very right insight which you talked about it. I think we all, right now I see 19 of us will have to take up our responsibility. Say what I have learned over the years, because by the blessing of the position which I have it and the opportunities I get to talk to a lot of colleges as well as the schools. A few days back, I was in DPS, then Little Flowers, and today I'll be addressing people in ASCI, Administrative Staff College of India. What I would want to tell you is the college, the students listen to everybody except their own parents. वो बहुत पुरानी कहावत है साहब कि घर की मुर्गी दाल बराबर. Okay, so now we all understand that, though obviously parents have to be the role model. We need to understand where they need to hear to whom, number one. Number two is when do they require a professional help. We definitely in our society undermine the importance of a psychiatrist. We always believe the very dirty statement, wo pagalo ka doctor hai, and we do not go to him. So I think these things we need to discuss it out. And today, World Mental Health Day is about recognizing the role of each one of us, and especially the professional help as and when needed. I really thank Dr. Mozam sir and Dr. Santosh for giving this their input from their side. Any other viewpoints from anybody seniors? I'll be very happy to take it at this time. Dr. Kranti sir and others.
Yes.
Yeah, I would be very happy to share that this video is being recorded, and we will be sharing the clip to each one of you and all the participants. We'll be very happy if you add your comments, and make sure, I request all the participants that this should go to every single person possible. And today, the 10th of October, let's do our part of discussing, of sharing, of talking about suicide, of talking about depression. One big tsunami of it, which is killing 1.5 lakh Indians every year. The whole world is one side, that is 8 lakhs. And our world is 1.5 lakhs, is a big number. As you have said, every 1 hour, there is some student committing suicide somewhere in India. And with the tragedy, we've had it in IIT Hyderabad, as well as lovely professional university, where 2 students committed suicide in 10 days gap. I think there is a much bigger role which we all need to play, as well as to save our future. Dr. Subrimal Bhattacharya, sir, any final comments from your side?
No, it's okay. It is an excellent discussion, and it is taken in the right time. And I thank to Dr. Kranti and particularly Dr. Ashish in organizing such a seminar. And thanks to all the participants. With this
Thanks
one,
a lot for that wonderful words, Dr. Bhattacharya sir, the senior consultant from Apollo Hospitals. I would be requesting Dr. Garima, Dr. Sarita, and Nalini, a woman voice. First and foremost, thanks to Garima for having organized this from Here and Say Clinic. And there's a role which a woman, which the mother and the wife and the sister of the society has it to address this issue of depression. I would be very happy to have a few words from your side before we take a final close. Dr. Garima?
Thank you so much, sir, for giving this opportunity. Sorry, I couldn't switch on my camera. I've just come from a travel, but we will look forward for this kinds of discussion in future also. We have got so many eminent doctors from different professions here, and it will surely be a very fruitful thing for people to see in future also at the recorded session. Thank you.
Any comments from any other ladies, please? Ladies have always been the silent when it comes to the larger platform like this, and we definitely respect them for the same. My dear friends, as we close this session, today is World Mental Health Day. And today I would want you to remember this acronym. M is for the mood disorders. Please talk about it. It's important. It's your and my duty. E is for eating disorders, anorexia nervosa and bulimia nervosa. They even kill. N is for the neurotic disorders other than the ones which we have already discussed it out. T is for trauma-related disorders, postpartum trauma, PTSD, the post-traumatic stress disorders, sexual assault in the childhood time or teenage time. A is for alcohol-related issues. One of the very big issues in the society is alcohol-related. And L is very simple, least, but actually the deadliest of all, which can be managed well, is the psychotic disorders or schizophrenia. Know when and early to refer the patient to the psychiatrist and do your appropriate job of making sure that person gets the right treatment at the right time. And with that note, I would want to thank Dr. Kranti sir for having taken this pain of doing this duty on World Mental Health Day today, as well as Dr. Minhaz, another psychiatrist, and every single one of you, not to forget Dr. Garima and Dr. Abhishek, and the president of Lions Club of Hyderabad, Allied Doctors, Dr. Srinivas in absentia, for all of you to having joined. We already have a representation of Shiva Kumar Makana sir from the Lions Club,
one of the very bold voice who keeps doing a lot of events to save society in the given situation which we have it post-COVID pandemic. We thank
Sir,
Dr. Sunil, the pediatrician, and Dr. Evelyn and everybody else for having joined. Any question? We will be very happy to take it. Otherwise, we will close it right now.
Dr.
Yes,
Ashish,
sir.
one small input I would like to put in.
Please.
See, I think we are all going very peacefully with those words like mental and all those things. I think there is something which we called, I had started a small experiment at home. So I just wanted to share that. Can I share it?
Yes, please go ahead.
So this is called as peace at home.
Okay.
So what I have done is that, see, we have been seeing as the children are growing up, over a period of time, they've been distancing themselves. They're going off to the rooms, they're with their gadgets, they're not communicating much. So we had started a program called as Introspective Session. So this is once in a month we conduct, wherein we ask, suppose it's between me and my wife and me, if you have anything which you liked and which you didn't like. For example, even for the children, like what anything you liked and you didn't like. So this sort of a question we had put in. So then I said, okay, since on Sunday we sat down and I asked my daughter, we had started almost around 3 years back. Then I asked my daughter, since she's the youngest, I told her, okay, see, this is the thing that you tell me what you don't like. Dad, I don't like your behavior, she said. I said, why is that for? I haven't done anything which I remember. She said, no, you shouted at me. I said, there would have been some reason I would have shouted at you. Then she said, yes, I was playing with the ball. You warned me once, twice you warned me. Third time also you warned me, but I was in a playful mood. And the ball, when it hit the jar, it fell on the floor and the glass broke. And then you shouted at me. I said, that was very natural. She said, no, the servant was standing behind. And then I said, okay, fine. Then she said, no, that's not it. There's something else to it. Then I asked what? She said, why didn't you ask me, Amma, are you safe or not? You're more worried about your jar. You see, there are a lot of things to be learned from home. I think unless and until we create that environment and atmosphere, then only the kids will open up. Because they may seek advice from outside and they can disturb the entire peace at home.
That was a very great insight, Moazzam Sahab, and I'll be very happy if you take a session for all of us in any given time in a day or two, because yes, that is very much needed. Ati ka bhala na barsna, ati ki bhali na dhoop, ati ka bhala na bolna, ati ki bhali na chup. So with that note, we will understand that yes, handling these issues are very, very sensitive and not that easy. We've had a great fruitful discussion. With that, we will come to an end of it. I would ask Dr. Garima to end with her closing remarks, and a big thanks to every single one who made it possible. Dr. Garima.
Thank you so much, sir. I appreciate Dr. Moazzam's inputs, and definitely we look forward for the session. Thank you, Dr. Kranti, for taking out time from your busy schedule. Thank you, Dr. Abhishek, for hosting it. Thank you, Dr. Ashish, for moderating it. And thanks to all the other esteemed panelists to contribute with their thoughts. Time for closing. Thank you all. Have a nice day.
Thank you. Good.